Hello everyone. Today our topic is humerus. Humerus is the one of the bone of the upper limb, and it is the bone of the arm. It is the longest bone of the upper limb. Longest bone of the upper limb. It has an upper rounded end. Has an upper rounded end and a lower flattened end. Flattened end in a triangular shape and a shaft. Side determination. The upper end is rounded in shape to form the head of the humerus. The lower end is expanded from side to side, and flattened from before backwards. The head is directed medially upwards. And backwards. It has posteriorly olecranon fossa. It is the side determination of the humerus. Features: it has upper end, shaft, and a lower end. We will discuss about upper end. The upper end the head is directed medially backwards and upwards. It articulates with the glenoid cavity of the scapula to form the shoulder joint. The head forms 1/3 of a spear and is much larger than the glenoid cavity. One-third of spear and it is more larger than the glenoid cavity of the scapula. Glenoid cavity of the scapula. It is the humerus head. The lines separating the head from the rest of the upper end is called the anatomical neck. The lines separating the head of the rest of the upper end is called the anatomical neck. This line separates the body of the humerus, rest of the body of the humerus, that is called the anatomical neck. The lesser tubercle is an elevation on the anterior aspect of the upper limb. Is the lesser tubercle, which is an elevation of the anterior aspect of the upper end. The greater tubercle is an elevation that forms the lateral part of the upper end. This is lateral part. This is anterior. Lesser tubercle is placed at anterior aspect. Greater tubercle is present at the lateral aspect. Its upper and posterior aspect marked by 3 impressions: upper, middle, and lower. It is marked by upper, middle, and lower. The intertubercular sulcus. This is intertubercular sulcus. or bicipital groove separates the lesser tubercle medially from the anterior part of the tubercle. The sulcus has medial and lateral lips. It has lateral lip and the medial lip. Next, morphological neck. Lies at the junction of convex end of the diaphysis with concave end. This is concave end of upper epiphysis. It disappears in adult. At the age of adult, it will be disappear. And convex end of the humerus from the shaft is called the morphological neck. This is a concave end. This is convex end. Concave end of head and convex end of diaphysis. This has morphological neck. And the surgical neck. The narrow line separating the upper end. The narrow line separating the upper end of humerus from the shaft is called the surgical neck. It lies 0.5 centimeters 0.5 centimeters below the morphological neck. Next, shaft. The shaft is rounded in the upper half and triangular in the lower half. It is rounded in the upper half and triangular in the lower half. It has borders, surfaces, that is 3 borders and 3 surfaces. The upper 1/3 of the anterior border forms the lateral lip of the intertubercle sulcus. Upper 1/3 of the anterior forms the intertubercular sulcus. Anterior forms the intertubercular sulcus. In its medial part, it forms the anterior margin of the deltoid in the anterior border. Delta tuberosity. The lower half of the anterior border is smooth and round. Lower half of the anterior border is smooth and rounded. The lateral border. The lateral border is prominent only at the lower end where it forms the supracondylar ridge, that is lateral to supracondylar ridge. Lateral border away from the body is prominent, means more likely only at the lower end where it forms the lateral supracondylar ridge. In the upper part, it is barely traceable up to the posterior surface of the greater tubercle. It goes into the greater tubercle. In the middle part, it is interrupted by the radial or spiral groove. In the middle, it is interrupted by the radial groove or spiral. The upper part of the medial border forms the medial lips of the intertubercular sulcus. Medial part gives rise to the medial lip of the intertubercular sulcus. Surfaces. The anterior lateral surface lies between the anterior and lateral part of the humerus, that is anterior lateral. The upper half of this surface is covered by the deltoid. upper part is covered by the deltoid. A little above the middle, it is marked by V-shaped deltoid. Above, a little V-shaped deltoid, Greek triangular shape, tuberosity. Behind the delta tuberosity, the radial groove runs downwards and forwards across the surface. Here, the radial groove passes across the radial tuberosity, that is downwards and forwards across the surface. Next, anterior medial surface. The surface lies between the anterior and medial parts is called anterior medial. Its upper one third is narrow and forms the floor of the intertubercular sulcus. Yes, forms the floor of the intertubercular sulcus. A nutrient foramen is seen near the medial border below its middle part. Nutrient foramen is seen in the medial border at its middle part. Nutrient foramen is where the nutrient artery will goes into the nutrient foramen. And then posterior surface. Posterior surface lies between the medial and lateral borders. Medial and lateral borders is posterior surface. Its upper part is marked by an oblique ridge. Its middle part, that is one third, is crossed by radial groove. Lower end. The lower end of the humerus forms the condyle, which is expanded from side to side. That is called condyle and has articular and non-articular parts. It has articular parts means which is articulated means attached to the another parts. Includes the following articulating parts. First, capitulum. Capitulum in Latin, little head, is rounded projection which articulates with the head of the radius. The head of the radius. Head of the radius. Next, trochlea. Trochlea, medial edge of the trochlea. This is trochlea. In Greek, pulley is a pulley-shaped surface. It articulates with the trochlear notch of the ulna. I will show you how it represents in ulna. This is where the ulna attaches to the humerus. This is olecranon fossa. I said in the posterior aspect we have olecranon fossa where the olecranon process of ulna will be attached. Next, coronoid fossa. Coronoid process of ulna is attached to the humerus. Yeah, here coronoid fossa and radial fossa. This articulates with the radius and this trochlea articulates with the trochlear notch of ulna. And it forms the, when trochlear notch is attached to the ulna. It forms the carrying angle. This is the carrying angle when it attaches to the trochlea. It forms a carrying angle. It is called the carrying angle. How it be seen when it is placed in the anatomical position. You can see the angle over here. Carrying angle formed by long axis of arm and long axis of forearm. Long axis of arm, and this is long axis of forearm. Elbow extended and forearm supinated. How much angle it is formed in male is 5 to 10 degrees and in female 10 to 15 degrees. Means in females it is more due to pelvis is more than the male in females. Next, non-articular parts includes the medial epicondylis prominent bony projection. Medial epicondylis prominent in bony projection, which we can palpate in our medial side, and it is subcutaneous. The lateral epicondyle is smaller than the medial epicondyle. Its anterolateral part has muscular impressions. The sharp lateral margin just above the lower end is called the lateral supracondylar ridge. Sharp edge above the lateral epicondyle is lateral supracondylar ridge. The medial supracondylar ridge is similar ridge on the medial side. Medial supracondylar ridge. The coronoid fossa is a depression just above the anterior aspect of the cochlea. Is a depression over the cochlear notch of the cochlear edge of the humerus. It accommodates the coronoid process of the ulna when the elbow is flexed. The radial fossa is a depression present just above the anterior aspect of capitulum. Anterior aspect of the capitulum is the radial fossa. It accommodates the radial head when the elbow is flexed. Olecranon fossa lies just above the posterior aspect of the cochlea. It accommodates the olecranon process of the ulna when the elbow is extended in an extension position. Thank you. Have a nice day. We will see attachments in ossification and clinical anatomy in the next part. Jai Hind.